actually the best thing I did coming here. It is.
Matthew Price reporting from Wakefield. Well, joining me here in the studio is Niall Dickson, who's Chief Executive of the NHS Confederation, the organisation that represents all the many of the providers within the NHS. Good morning to you.
Good morning.
Now, the watchdog, the NHO, did not look at these vanguards. They will be doing that next year. But they did find that the whole direction of travel of the NHS and social care, this plan to integrate, has not made any improvement, which is rather shocking, isn't it? And extremely worrying.
Well, I think everything that's been shown in the BBC week of looking at the health service shows a system that's under enormous strain, that doesn't have the resources or indeed the staff to manage current demand, and in particular that social care has seen in effect significant cuts in its budget, and that is having a very profound effect on the rest of the system. So that's lesson one. I think you've illustrated that. And I think you've illustrated the second lesson in the report that we've just heard, which is that we are beginning to see, and it is early days and it will take time, that there are ways in which you can integrate services much more effectively and that will unblock some of the system that at the moment is creating bits of the problem. So additional resource is necessary, but it's not sufficient. You need to have a system which is more 21st century, dealing with the huge number of elderly people who've got lots of different conditions, and you need to be able to unblock some of the blocks that are currently in the system to make it more effective.
OK, but so the whole direction of travel of integrating NHS and social care should not be knocked off course, should just continue, despite what the National Audit Office is saying.
Well,
and this is, of course, specifically about England, we should make clear.
I don't think that National Audit Office's argument should be knocked off course. I think it's absolutely right to say, let's worship yet another god and say integration will solve all the NHS's problems. But I think there's also a recognition across the whole system that simply putting more money into the system without looking at how this system works and making it more effective and more modern in the way that it goes about its business will not solve the problems.
I mean, when I spoke to the Director of the National Audit Office, Ashley McDougall, earlier, he said it's not wasting money, but it isn't having the effect that they want to achieve, so it would be better to spend the money elsewhere, and they probably know that.
Well, I think that he may be talking about two different things, of course. He looked at an earlier fund, which was a first attempt at this. We now have, and you touched on it, this word vanguard. We now have these pilots all over England which are being tried out. Again, I think the hope, politicians mustn't have too high expectations, but I think we are beginning to see evidence, and you've just heard a very good example of it, where you can start to reduce some of the demands that are being made on the hospital side of things, but you need to build up community services. You need to manage older people, and there are many, many more of them now. This is not like some other public services which aren't seeing huge extra rises in demand. The system is trying to cope with huge amounts of extra demand. I think you've illustrated that yourselves very well.
But in a way, in that report, what one heard was it's not entirely surprising. I mean, if an old person likes singing and it helps them take their pills, what's new about that?
Well, what I think is new is that if you go to the leaders, and I think there is a leadership issue here, of health and social care, and by health I don't just mean the hospitals, I mean how do hospitals tie up with communities, how do they tie up with general practice? The truth is that our system has been fragmented both within the NHS and between the NHS and social care. Getting these people together to realise that improvement within your own organisation, great, but on its own, it will not be enough. This is about how do you link together and provide a system that recognises that patients will move across different services and orientate those services more for them. Even the financial system is not aligned at the moment, so people are encouraged to do more activity rather than to try and work out what the best place for the care to be given in.
Niall Dickson, thank you very much. The time is now 23 minutes past 8. In 2008, the disappearance of 9-year-old Shannon Matthews in Dewsbury, West Yorkshire, sparked a massive search involving the police and the local community. After 24 days, Shannon was found hidden under a bed in the home of Michael Donovan, who was found to have faked the kidnapping with Shannon's mother Karen in order to claim a reward. Last night, the first part of The Moorside, a dramatisation of the case, aired on BBC One.
Police emergency. I want to report my daughter is missing, please. What do they call her? Shannon Matthews.
I just want her found.
And we'll find her, love. The response of this community has been absolutely amazing.
Please tell